Hello, everyone, and welcome to today's presentation on return to work guidance. I'd like to introduce today's presenters. We have Tim Rogers, who is Safety and Loss Control Specialist with Valent Group, the Risk Management Division of EBSCO Industries. We're also joined by Tom Scroggins and Brooke Nixon with Constangy Brooks, and they are excellent employment lawyers. You're going to have a lot of great entertainment today. A recorded version of this webinar will be available after the event ends. We have a few housekeeping notes. So we've muted all participants upon entry, and Brooke and Tom will be unmuting speakers as they share. You can choose to have your camera on or off. That's your preference. You can also choose to show you. Our speakers will be sharing their webcam while they are presenting, so you are welcome to join and watch them, but you can just select that in your own settings. We are offering CEs for this course, so information will be provided at the end for how you can apply. We are also using the chat box, so currently if you open up your chat, we have Jade Foster inside of our chat room. If you're experiencing any technology difficulties, please chat with her. She's already prepared a welcome note with a link if there to any kind of the settings, if you would like to click on that and set your preferences. We definitely love to hear from you. We are hosting a live Q&A at the end of this presentation. And so include any questions that you have in the chat, and I will be asking those of all of our speakers at the end of their formal presentations. So the webinar will last approximately 1 hour. For those of you just joining us, welcome. And Tim, let's get started.
Before I get started, I want to let you know that the information that I present is big picture information. It's intended to offer everyone ideas for conducting business during the current pandemic. This is a marathon. This is not a sprint. Please understand that. We've got a lot of work to do, and it's not going to end in a week or a month. So it's kind of something we have to buckle up for and do a lot of work preparing. Many of you know me, and you know that I'm all about reducing risk and reducing losses to your company. Because conditions can change quickly, it's important for us to prepare thoroughly so that we can make changes immediately when they're needed. So moving on, well, first of all, I want to talk about or just tell you that the CDC gave us some new symptoms to help us recognize among customers, employees. In addition to the fever, cough, and shortness of breath, they added chills, repeated shaking with chills, muscle pain, headaches, sore throat, and new loss of taste and smell. Those are key. Those will help you as the employer to coach your employees, recognize the signs and the symptoms, and even with your customers also. Okay, so who decides? Is it the state? Is it local? Is it the business leader? What information are you going to rely on? It's very important to get good information, to have good sources for your information, like your local county, your state health department, your county health department. What is the local conditions? I think it's important for us to every day to check the conditions, check the news to see what's going on in our cities and in the areas that we service. Like I said earlier, this is an unseen threat to our lives and businesses, so we need to plan and do everything we can. We've got to implement policies and procedures, measures that will protect our employees and our customers for the foreseeable future, for the next year. You need to define your go, no-go zones for your employees and your customers as they visit you, come onto your campuses, come into your facility. Think about what you will allow them to do, and how are you going to empower your employees? How will you prepare to reopen? This is You know, I've mentioned this a few times already. What we do is restaurants have been in the news as far as the preparation or the way that they're conducting business has been curbside. But now it comes to they have to reduce the number of clientele and have to spread tables. And that, if you think about that for your own business, whether it be a health club or a school, college, whatever your business type, are you going to spread your employees out? If you have cubicles and desks, you need to spread those employees out. How many customers are you going to let inside? Those have been, that kind of information has been in the news. But for one of the first things you need to do is to identify that key person or key persons in your company that will be able to answer your employee questions and your customers' questions. It might be on the phone, it might be through emails, but you definitely, your employees, they're going to need training and they're going to need answers about how you want them to conduct the business. I suggest that you make lists of resources that you can rely on for safety, for your insurance carrier, for your insurance broker, a trusted legal resource, and you probably may belong to a professional business organization that you could go to for information. There have been a lot of government changes that will affect your employees and your business, but especially your employees. And you need to study up on that so that you can address those, have answers to those questions for your employees. What considerations for the business owner? Plan on employees and students, customers, an illness. If they develop an illness and they make you aware of it, what steps will you take? You need to have a plan on how to do that. How will you protect your employees and students and customers? Are you going to require PPE and sanitizers and distancing? And a lot of those are common practices. The CDC recommends it. The state even recommends it now. How will you prepare your employees for communicating with your customers, your clients that come in the door? Your employees are not going to know how to do this unless you train them. How are you going to prepare your customers? Emails, texts are great methods to do this, but you have to develop that communication, that language that you want to use. A lot can be communicated on your website also. To me, that's a great place to start. That's where a lot of people are going to go to first, then they're going to contact. So I would start there. How many employees will you allow to ride in the same vehicle if they're out servicing customers? That's a very, very important thing to consider. Your employees are probably going to be a little nervous about returning to work, and you need to explain those things to them and how you're going to protect them. Will you close your break rooms, or will you take the chairs out of the break rooms? How will you do that? Anything new will require written documentation, or should be documented in writing, so that you have something to go on, so that you can be consistent the way that you communicate with your employees. You have consistent policy and procedure. If you do require PPE, OSHA has strict standards and requirements for training, in some cases for medical evaluations that the employer has to provide, and hazard analysis. We open in phases. A lot of companies are opening phases. They'll bring in key employees first to help organize and develop those policies and procedures, and then they will phase other people in and move the desks around. Maybe they only send a few people out into the field so that they understand what those employees are going to be facing, so that they can, I mentioned before that you're going to need to be able to pivot, to be able to make changes immediately upon notice of something. And this would give you a relatively easy way to do that, so that instead of bringing everyone back at the same time. If you have an exposure event, how are you going to handle that? Do you have plans? Do you have written plans to cordon off the area, to make contact with that customer, with those employees, the contacts that they've had also. So contact tracing is a big deal. I'm going to get into a little bit more of that here later on. Most of you'll notice in the second bullet point, I'm not going to read through these. You guys can do that. An EAP, a lot of you know that that's an emergency action plan. A lot of us know how to prepare for a hurricane. It's something that in this area we're just used to doing. And so I want to encourage you, pull out your emergency action plan. You might have some information in there that you can use for these times, but that's kind of, you need to get into that mode of preparing. When we know that a hurricane is coming, we have very specific steps we do, and a lot of people they know it like the back of their hand. But I would encourage you to log your employees' activities, where they go, what they do. If they're out making calls to customers, that you keep a log of the customers that they cross, that they come into contact with, because hopefully it will not happen. But we have to prepare for our businesses, someone to have COVID, that either we cross a customer or one of our employees comes down with COVID-19. And you need to be prepared for that. So talk to your employees about keeping track of where they're going and letting you know where they're going. Maybe you develop a form that they keep track daily and turn that into you daily. We have heard of a few lawsuits from employees that don't feel like that they were taken care of by their employer. They weren't prepared, they weren't trained. So that's about all I'm going to say on that. But it goes to the importance of preparation and training. Make sure that you do a very thorough job of that. I hate to bring this up, but they're predicting that the coronavirus is going to come back fierce again in the fall. But what can we do now is to prepare. If we do have to reclose, it's important for us to do what we need to do now, right? So I hope this doesn't happen. But instead of preparing to reclose, let's do it right this time, the first time. And this means training employees well and coaching them and dealing with greeting customers and distancing, sanitizer, riding in the vehicles, not going into overcrowded spaces. And remember that log of daily activities, that is probably going to come in handy for you at some point. I hope that your employees don't come down with COVID or that a customer doesn't, but I would encourage you strongly to start that activity log to help you if you do have to do contact tracing. Short term, for me, short term has changed. It's now 1 to 3 or 1 to 6 months. Long term is 1 to 6 months to a year, because this is how long we're going to be in this COVID. At least that's the predictions. There's not going to be a vaccine for quite some time. So we need to make sure that we have good policies, procedures moving forward. Monitor your local conditions. Very important. That's one of the first steps that you can do every single day, is to monitor that the local conditions. So, and to check your employees' temperatures daily when they report to work. Are you going to check your customers' temperatures also? Employees need to be trained. You need to train them on the symptoms, and now we have new symptoms that they need to be trained for. And like I said, the more training that you provide, the better educated they are. They know how to respond. Will you ask your customers about their exposure? Will you ask to take their temperatures? Will you give and ask your employees, kind of coach not your employees, but coach your customers in that contact. If it's an outside visit to someone's home or a business to service them, ask them to follow your procedures so that you can protect your employees. How will you clean and disinfect merchandise that might be handled on the shelf or might be delivered to your back dock? Or how will you do that? Or will you need to? Employees might wear PPE, and if you require it, like I said before, you're going to have to provide training. Will they be just handmade cloth face coverings, or are you going to require an N95 type of respirator? Different requirements for different face coverings, for different face masks. And there is a difference between a face covering and a mask. Talk with your insurance broker, with our loss control person about that. What will you do if an employee becomes sick at work? Very important. You need to identify or create a safe room, a safe place. And I would suggest that employees, be taken outside if the weather permits and the situation permits that. And that you have, water available, that you have sanitizer available, that you have all these supplies available to all your employees, and especially when you have to respond like that. Your safety committee, coach them through responding to an employee illness and or customer illness too. You'll want to make sure that employee is safe right away, but you'll want to give them information on where they can be tested and how they will do that. And your safety team, are they going to clean up, or are you going to have an outside contractor do that? If you're going to bring an outside contractor in for the cleanup, certificates of insurance are very important. Work with your insurance broker on having the proper information. And that's something you can do now. For that key COVID-19 contact person that I mentioned at the beginning of the webinar, they should have a list of the contractors that can respond and help clean the office. But one of the questions that you have to answer: are we going to allow employees to do it, or outside contractor, or are we going to close the business down and let the virus settle without necessarily having to clean up? Are you prepared to reopen now? There's many things that the COVID has affected. Cyber is a big thing. It has affected a lot of businesses through the internet, through emails, and there's a lot of people taking advantage of the situation. So please be aware of that. Is this going to affect workers' comp? If you have an employee who says that they are sick from COVID and it's because of their work, how is that going to affect? Do you need to open a claim, file a notice only? Work with your broker, talk with your broker about those things. And your exposure to the risk, what do your employees do? The greater exposure you have, the more steps, the more training, the more documentation that you need to have in place so that you're ready. Nobody likes extra work, but this is not extra work. These are steps that you need to take, that we need to take to prepare if that time comes when we do have a COVID case in our office or in our workplace. Identify that key employee, so important. I've mentioned it several times. That person, or two or three, need to be able to answer a lot of questions. And again, the training, if you require PPE, training is required, and there's a lot of steps into the training process. It's not difficult, but it is required. And like I said, if it's an N95 situation, you will have to do medical evaluations. What about your suppliers? Can they supply you long-term, short-term? Do they have enough inventory? Will you need to have a backup supplier? I would say so. When those delivery truck drivers may come to the back dock, what's your policy going to be? You need to have some instruction in place so that your receiving department can instruct those drivers not to get out, stay in the truck, we'll take care of it. Have sanitizer in the dock area so to keep your employees safe back there, and they won't be able to wash their hands that often, but if they can use sanitizer, that would be good. Develop a proactive marketing flyer to add information to your website. This is a marketing person's, this is where their expertise is going to come in very handy to you as a business. And this can be posted on the website, and this is what people are looking for. Remember that, I'm going to read this one to you. Upon notification of illness by an employer or customer, best practices are going to recommend that you begin the process of contact tracing. And this goes back to what I said earlier, as far as a log of where your employees are going, where they've been during the day, so that you're going to be starting off the right foot. You're going to have so much information if you already have these in hand. You'll be able to start contacting employees, customers, because you'll have a list of the contacts available to you. It's a very important step here to be ready for this. Signage. This is, we're all going to have to do this. And this is how you're going to educate your customers and your employees, but especially your customers that are coming to your facility, or even if you're going to their facility, your employees could carry an information flyer with them to hand to that customer. And here are some samples. If you could express that you appreciate this is the first time for everyone, so people are going to have a little bit of patience with you. Another example here, but long-term continuous training is ever so important. PPE supplies, make sure you have enough. Update your plan often, and sometimes daily, but it's going to be more weekly to monthly. There is return to work guide that we've created that hopefully, probably a lot of you have seen it. I hope it's been helpful for you. It goes in a lot more detail than I have here. We also have a resource page on our website. Contact your insurance broker's loss control specialist manager for more help. And there's my information if I can help out. Also, if there's 20, if I can offer 20 minutes or so, 15 or 20 minutes or so, you can email me and I can talk with you about maybe some ideas for your company.
Thank you, Tim. This is Tom Scroggins and Brooke Nixon. I hope everybody was listening. That was some very good information, things that you need to consider as you get your employees back into the workplace. We're going to continue on that theme and talk about some legal considerations. And we're coming to you today live from the Constangy Broadcast Studios, which used to be in olden times a conference room where we had actual meetings and depositions, and we haven't had one of those in a couple of weeks. So we're looking forward to getting back to that kind of stuff in the next few weeks. I'm sure as you're looking forward to getting back to work as well. And I hope everybody's doing well. If you're like me, you're in bad need of a haircut and maybe 3 months or 2 days at a gym for the foreseeable future. But again, hopefully we can get back to some semblance of normalcy here pretty soon. And we want to talk about how you do that and what are some of the laws that are impacting that. We're going to start with something that's, I guess, relatively hot off the press, the Alabama Safer at Home order that came from Governor Ivey. It was announced Tuesday. And then we're going to go back and talk about the FFCRA pay leave provisions, which some of you may have had some experience with so far. And so it may be a little repetitive for you, but some of you may have been shut down and you've had everybody furloughed for the last 4 to 6 weeks, and you may not have had to deal with some of these leave issues. So, and that may be coming up on you here pretty soon as you bring employees back to work, because I think my prediction is, and it's already starting to come true this morning before we even got on this Zoom webinar, is that one of the biggest challenges employers are going to have is just coaxing their employees back into the workplace, because you've got a couple of factors going on there. One of which is, and people are just scared. A lot of folks have been home for 4 to 6 weeks. They're scared to come back to work because they're scared they're going to catch the virus or contract COVID. And also, let's just be honest, there's a lot of employees who've been at home drawing unemployment to the tune of $875 a week, some of whom are making more not at working than they were at work. And so getting them back to work may be a little bit problematic. We're going to talk about how to recall some of those employees and what to do if they refuse to come back to work. And I want to mention for sure that everything here is changing constantly. The laws that were on the books already before this started really didn't deal with this situation. So we've had Congress go and pass bill after bill after bill after bill over the last month or so pretty rapidly. And it's caused a lot of compliance issues for employers and businesses. And to try to figure out all these things in such a rapid fashion, and things are changing. The guidelines are being issued by the federal government daily. State governments are issuing new guidelines and orders daily. Municipalities are getting into the play right now. As you may have seen, the city of Birmingham had issued an order earlier this week requiring masks to be worn in public, which is not something that's in effect broadly across the state. It's not something that was in Governor Ivey's order. And for those of you, there may be some people here that are not in the state of Alabama. Thank you for coming. This is mostly an Alabama-centric presentation, so I'm going to focus a little bit on this Safer at Home order. But I want to encourage you to, if you haven't already, check your state and perhaps even your municipality's shelter-in-place order or stay-at-home order or whatever they're calling it, because those orders may be more restrictive than what Alabama has put into place and what we're going to talk about a little bit more in detail here. There's been a patchwork and frankly a broad variety of orders that have come out. Some of you may know that the state of Georgia opened up pretty broadly last week. I mean, if I wanted to, I could have gone over to Georgia and gotten a tattoo last Friday, but you can't do that in Alabama. You can't even get a haircut right now, but that may change here in the next couple of weeks. Also want to point out our website, Constangy.com, has constant, daily, sometimes frequently multiple times a day, updates on this kind of stuff. Yesterday we published a return to work FAQ. The URL is right there if you'd like to go take a look at that. And at the end of this presentation, there's a slide with Brooke and I's contact information. Feel free to call or email with questions. We'll try to take some questions at the end of this, but some of those may be too detailed or too long to address here with everybody. So feel free to contact us directly. So with that, we're going to start with talking about the governor's new Safer at Home order. So it was in effect yesterday at 5 p.m. Some of you who may have watched the nightly news last night saw all the congregants at Gulf Shores. I think when they lifted the gates at 5 p.m. yesterday, people literally rushed onto the beach and jumped in the water, because you can do that now. But the order, the biggest change is previously, unless you were traveling to an essential business, on the face of the order anyway, the order was pretty strict. It said you were ordered to stay at home. Now the order has changed to, we're encouraged as citizens in Alabama to minimize travel, encouraged to wear face coverings, wash hands frequently, not touch your face, which for me has been very difficult to do, sneeze into your tissue or elbow, and then disinfect frequently used items. Now, it does order that if you're COVID positive, you are quarantined for 14 days. So if you happen to have an employee or if you yourself test positive for the COVID, then you are ordered to quarantine for 14 days.
So normally when we hear these things on the news and we get a new shelter at home order or we get a change to the order, the government, the state, municipalities, they will put out these nice little fact sheets like you see here. But we're really encouraging for you to go and look at the actual rules, because a lot of times we don't get everything that we need just on the face. So we're going to go over just briefly some of these that are relevant to Alabama's Safer at Home order for employees and employers particularly. So here, also wanted to make a point, we are going to make these slides available to you, so don't feel like that you have to memorize everything that's on these slides or take any screenshots of us or anything like that. So protections for employees, effective April 30th, that was yesterday, and this stays into effect until May 15th. Employers are supposed to take reasonable steps to ensure the following things: to avoid gatherings of 10 employees or more, to maintain 6 feet of separation between employees, which in some circumstances may be very difficult depending on the type of work that your employees do. Regularly disinfecting items, encouraging hand washing, preventing employees who are sick from coming into contact with other people, facilitating remote working arrangements where possible, and minimizing and not requiring employee travel.
Now there's some important language here in this order. It says all employers shall take reasonable steps as practical as work duties permit. So is it absolutely necessary that everybody stay 6 feet apart at all times? If you read this, I would say no. If there's a short period of time in which employees have to be in close contact with each other, fewer than 6 feet apart, that can be allowed. But generally speaking, as much as possible, you want to keep them 6 feet apart.
And then we've got another set of instructions for customers. So I know that some of you guys listening on here, you may only have employees in your place of business, do not have a lot of customers, so maybe this is not applicable to you, but for others it may be. So avoiding gatherings of 10 or more people, maintaining 6 feet of separation, and regularly disinfecting, really the same type of issues.
Some of the things that, and I'll point out that one of the bigger changes in the Safer at Home order is all retailers are now allowed to be open if they engage in some of these safer work practices and protect customers. Some of the things that I see a lot of retailers doing are making aisles one way, so you can go only on the aisle one way instead of having a lot of foot traffic, trying to keep down the number of customers in the same aisle. Counting the number of people in the retail location. I frequently see retailers having folks at the front door with an app or something, counting the number of people coming in and leaving the store. That's something you may want to consider. And having retail employees wearing masks, either where they're ordering it. Some retailers are requiring it. Some are allowing it. I think in normal times, most retailers would prefer their employees not to wear masks, but now you may be requiring it. Now, here are some things that are still closed. So if you happen to run or own one of these businesses that I'm about to list, unfortunately, you're still closed through May the 15th. Some of these businesses may be allowed to reopen at that time. We don't really know yet. I think the governor is going to go through a phased plan. So some of these may be allowed open on the 15th, and then some will be stalled a little bit. So you got entertainment venues, nightclubs, bowling alleys, concert venues, gyms. Sports requiring interaction within 6 feet are still prohibited. So maybe if you're a tennis player or a golfer, as long as you play, drive your own cart or walk, maybe you're okay. Close contact businesses such as barbers, nail salons, massage parlors, still closed for now. So where are we at in this? Now, this is going to pass eventually. Now, it might pass like a kidney stone, but it'll pass. But we have to adapt and survive, and that's everybody, including us as a law firm. Everything's changing daily. Right now, we're sort of getting back to the end of the first wave, which is mitigating the initial health crisis, or as you've probably heard more than you'd care to say, flattening the curve. So it looks like perhaps we've flattened the initial curve to a pretty good degree. Now, the second wave is getting back to business in a responsible manner, and we may end up having another round of infections as we reopen some of these businesses. As people start congregating closer together, we may have a second round of infections. Who knows? We may not. It's unclear at this point. I guess we'll find out in a couple of weeks around May the 15th. And the fourth long-term wave, and the goal is to eventually get to an effective treatment or vaccine, and there looks to be there's progress being made there. But if you listen to the healthcare professionals, that may be 18 months to 2 years off. And so in the meantime, we've got to do what we can to work together to try to mitigate this crisis, but keep the economy on life support and keep it from collapsing.
So as Tom mentioned briefly at the beginning, there are a lot of you who've probably heard and read a million articles about this Family First Coronavirus Response Act. But now we feel like that a lot of you will be really putting what you've learned into place as you're calling your employees back and seeing if they can come, hearing from employees who say they cannot come, and you just trying to figure out what you need to do and what response that you need to take. And a lot of the laws that were already in place, such as the ADA or the Fair Labor Standards Act, those are all still there, and we have to consider those in this new world. But now we have the new law of the Families First Coronavirus Response Act. The law is the floor. You can offer more, and we've had clients who say, look, I don't want my employees to go somewhere else. I don't want them to leave and go find another job. So I want to do the maximum that I can for them. We want to point out that even though we will be talking about what we refer to as the expanded FMLA, that it does not make all aspects of FMLA apply to all employers. You still have the requirement that if you have 50 or more employees in a 75-mile radius, then you deal with the entire FMLA, but otherwise you just look at this expanded FMLA.
So this law went into effect on April the 2nd, and there were a lot of employers who, out of the goodness of their heart, decided, hey, we will. Prior to April the 2nd, they had been providing leave in some form, some of it paid, maybe full paid leave, partial paid leave, something to try to keep their employees around and with some amount of pay. If you did that, good for you. I want to applaud you on that, but you're not going to get your tax credits, because that when we say the law is the floor, you only can get your tax credits that we're going to talk a little bit more in detail for the minimum that's required by the FFCRA. So what does it require, and who does it apply to? It applies to employers with fewer than 500 employees. So embedded in that, if you happen to be a, what I'd call a conglomerate of various companies or organizations, you may have a single or joint employer issue where you might have to aggregate your employees among those various entities to determine if the bill applies to you or not. And it's this threshold poses some interesting issues for employers, because let's be frank, most of the time employers are trying to figure out how to be as small as possible to be exempted from certain rules. And so if you go back 10 years, remember, after the Obamacare Act was passed, the 50 employee threshold for the mandatory provision of healthcare benefits, a lot of employers were trying to figure out how to get under that 50 employee threshold. Now on the opposite end of the spectrum, you've got employers trying to figure out, how do we have 501 employees to get exempt from that? I would say, play this straight. Don't play any games here. If you took a position previously on the number of employees you had and whether you're a joint or single employer, don't suddenly change now for this short-term period. It can come back to bite you in the future in future litigation, and particularly in a situation where the leave is going to be essentially the federal government paid through payroll tax credits for a relatively short period of time anyway. I will say this, it'll be interesting to see at the end of the year if some version of this paid leave becomes permanent. I know nobody's really talking about that at this point, but there's been a long push for years to get some part of Family Medical Leave Act, of the FMLA leave, paid in some way, either partially or fully. And I can see this as being a foot in the door towards getting there. All right, so this law requires paid expanded FMLA leave, emergency paid sick leave. You can't retaliate against employees. You got to give them their job back at the end of expanded FMLA leave. There's tax credits. There's a poster that goes with it. And of course, the enhanced unemployment grants to the states. So we'll start out with this required poster. Hopefully you have this up in your business if you have fewer than 500 employees. If you don't, there's the link right there that you can go to. It's free, download it, put it up with the rest of your required employment posters. You can also put it on your employee intranet if you happen to have such a thing. If you have a lot of employees suddenly working from home, teleworking, which a lot of businesses have that, at a minimum, just email it to them. The main thing is to get it distributed to them so they can reference it if they need to.
All right, so I'm going to start with the emergency paid sick leave. So I can't tell you how many times over the past few weeks since this was passed that Tom and I have gone through with clients and talked with them about each of these areas. And I feel like we're throwing out a lot of new words that, they've never had to deal with before, a lot of new language. So we're just going to try to explain here. I think that Tim mentioned it. This is kind of the broad overview. We talk to clients almost every day trying to walk through this. So I don't think that we're going to be able to answer, every one of your questions today on what to do with a particular employee. So you really just have to go through each of these situations. So going to start with emergency paid sick leave. It was effective April 2nd. It's for fewer than 500 employees. Eligible. Who's eligible? Which one of your employees are eligible? It's all employees on your payroll. No minimum length of employment. What's the amount of time of paid leave? It's 80 hours of paid sick time. What is their pay? Here it gets a little interesting, and you'll see what these 1 through 3 and 4 through 6 apply to in just a moment. But it's the regular, you provide them the regular rate of pay for their own illness, which is, 1 through 3, numbers 1 through 3, and 2/3 of their rate for if they're caring for others, which is numbers 4 through 6 under the law. But the pay cap. So if someone is out for numbers 1 through 3, which we'll get to in just a moment, there's a $511 per day, cap up to $5,110. And then if you're caring for others, it's $200 per day with a $2,000 cap. What's interesting here is that you cannot reduce your employees' paid time off benefits, and you cannot require them to, use any of their paid time or deduct any of their paid time. There's no carryover either.
So for example, I know some businesses were thinking, well, if the government's going to make us provide this 2 weeks of paid sick leave, we already had 2 weeks of paid sick leave under a company policy or some amount of paid sick leave. Why don't we just reduce that or get rid of that? And for everybody, either across the board. You certainly don't want to do it in a targeted manner for somebody who takes this leave. That looks like retaliation that's prohibited. And I've been cautioning folks, don't do an across the board reduction as well, because frankly, that looks to me possibly retaliatory as well. And I certainly don't want you to find yourself in a lawsuit over some paid sick leave that's relatively small and tax credited from the government anyway.
But I'll tell you, when March 15th, the beginning of March, March 15th came along and we did not have these laws, and our clients were calling and saying, we've got to shut our business. Can we make everybody use their paid time off right now? And our answer was yes. Before these laws came into effect, we were telling people, yes, if they need to be off for 2 weeks and they have 2 weeks of paid leave, then make them take the 2 weeks paid leave. And then we get this law and we kind of have to change some things. All right, so I said, 5 times on that last slide, 1 through 3 and 4 through 6. These are qualifying events for the emergency paid sick leave. You can see that numbers 1 through 3 relate to your employee's own health, whether they're subject to a quarantine order, whether they've been advised by a healthcare provider to self-quarantine, whether they are experiencing coronavirus symptoms and need to seek a diagnosis, because as I'm sure you've heard, this is not something that you can go get done in one day and have your results back. So there's a period of time where your employee may call you and say, I'm having these symptoms and I need to go get checked. They're not just going to be out for that day. And then you can see that 4 through 6 relates to caring for someone else. So 4 is caring for an individual who has either coronavirus symptoms, or maybe they're a medically fragile person who is more susceptible to coronavirus that your employees is having to take care of. Number 5 would be, as many of us are dealing with right now, we have no childcare, daycares aren't open, schools aren't open. So number 5 applies when you have an employee who says they cannot come to work because they have to take care of their child. And then number 6, we don't really know what that is yet.
It's not really in effect right now. It's sort of a catch-all provision that allows the Secretary of Health and Human Services and Department of Labor and the Secretary of Treasury to come together and shove something else, some other qualifying condition into this. That really hasn't happened yet. So in reality, you're looking at 1 through 5. And for number 4, I want to make clear, it's not just caring for any individual. It has to be somebody that usually lives in their household or they have some relationship with. They can't say, look, I'm caring for this person that lives down the street from me and get this leave.
Yeah, I was going to mention that the Department of Labor has issued pages and pages of guidance on this. And when this first came out, there was no guidance. And so we were providing this advice on, our interpretation of what it meant. And now I don't know how many questions and answers there's been, 70 or so, where you can go to the Department of Labor guidance. And a lot of times it will answer the specific, question. Like, for example, there's a question about, does this have to be someone, for number 4, does this have to be someone who's related to me? And generally it's saying yes, and they need to be living in your household.
Yeah. Normally, when you have this broad of an employer leave requirement, any kind of broadly applicable congressional legislation like this, it gets debated for months in Congress. You tend to know it's coming, and then once it comes out, the Department of Labor spends 6 months to a year, sometimes 2 years, developing detailed regulations that give you guidance on how to put that law into effect. Well, all that has been sped up and compressed into about a 2 to 3 week period. And we're not really getting any regulations. We get these guidelines, and it's really mostly it's in a FAQ format on the Department of Labor website. And so for a while there, and even to this day, largely, we are just trying to work with clients and give our best judgment and advice on how to, put these requirements into effect in certain factual circumstances. Because as you might imagine, the FAQs and the guidance and the overall broad statements in the statute don't really account for they tell you what to do in every particular circumstance. So it's, this is going to sound self-serving, but there's no better time to have a good relationship with an experienced labor and employment lawyer as you're trying to grapple with this stuff.
All right, so now we have to move on from the emergency paid sick leave to the expanded FMLA leave. This is a little different. To be eligible, your employee needs to have been on the payroll for 30 days. The amount of time is 12 weeks of job protected leave. The waiting period is 10 days of unpaid leave, and then starting 10 weeks of paid leave. The pay rate is no less than 2/3 of their usual pay. It is capped to $200 per day, and you cannot require your employees to substitute the leave.
So this is the second part of the second piece of the leave that's authorized under the FFCRA. So you get the emergency paid sick leave and this expanded FMLA leave. And at least in one circumstance, that they're intended to go together. So under the expanded FMLA leave, there's only one trigger for the leave. So the emergency paid sick leave has 5 triggers that are in effect right now. And only one of those triggers carries over to the expanded FMLA leave, which is the caring for a child who is home because the school or place of care or child care provider is closed or unavailable. And under the expanded FMLA leave, it's 12 weeks long. The first 2 weeks are unpaid, but if they take the emergency paid sick leave because they're caring for the child, they can get those first 2 weeks paid subject to the caps there of 2/3 of pay, and then the sub cap of $200 a day and $2,000 for those 2 weeks. And then those same caps carry over, essentially flows through the remaining 10 weeks of the expanded FMLA leave. It's intended to be a continuum of leave, at least for that particular circumstance. And for those of you who have been dealing with providing this leave recently over the last few weeks, some of these issues, while complicated as they seemed at the time, are about to get much more complicated because you're about to have employees who have triggers who may have had a trigger for emergency paid sick leave that was saved for their own diagnosis or because maybe they had COVID. And now as you're about to call them back to work, now they have a child at home that they're having to care for. They may be well, they've recovered, they've gotten a negative COVID test, but now they've got a leave trigger here that you have to deal with, but maybe they've already exhausted their emergency paid sick leave. So now they're on expanded FMLA leave, and that first 2 weeks will be going to be unpaid because they've already exhausted their emergency paid sick leave, and now they're on this expanded FMLA leave. So if you thought that this was complicated and difficult to put into place over the last month, it's about to get worse.
So I'm sure if you've had to deal with FMLA leave in the past, you've heard of intermittent leave, where you're not requiring an employee to take leave all at one time, but you're allowing them to take it, as they need it. So if one of your employees need to be off of work to care for their child, you can allow them to take intermittent leave. I've had a client say that, because of their child care situation, they can only work 3 days a week instead of 5 days a week. So then we can let them take that intermittent leave, those 2 days, for a period of weeks. And then that will get you through a good bit of time for an unpaid leave. So otherwise unless you allow them to, they have to take it continuously.
Now they might take it at separate times. They may take, 2 weeks now for this reason, but they still have the 10 weeks. They'd have 10 more weeks later in the year. But for that one particular reason, they'll have to take it continuously if you want them to, or you can allow intermittently.
Okay, yeah, so the next thing is the exemption. I'm sure that many clients heard, I have, less than 50 employees. I don't need to pay attention to any of this. And honestly, that's a lot of times what we were hearing on the news. It's just if you're under 50, you're going to be able to be exempt.
But it's not that simple.
Not that simple, and that's just not how it ended up happening, in the law that was passed. So you can require documentation. We'll talk about that a little bit more. But if you have fewer than 50 employees, you can be exempt from the requirement to provide the expanded FMLA leave for the care of the child that does not have a school or daycare to go to, or the paid sick leave for that same reason, which is, remember, reason number 5, if you have an authorized officer of the company determine one of these 3 things. We're running short on time, so we're not going to go through all of those, but you will be able to get these slides and you can take a look at that. But I would just caution you that if you're thinking to yourself, I'm definitely exempt, I'm just not paying attention to that, you really need to look at this because you're going to have to make this certification.
Bottom line is, if you have fewer than 50 employees, you're not automatically exempt. You have to be able to and be willing to essentially certify under penalty of perjury. And it is a self-certification, and you don't have to send it to the DOL. One of these 3 things, essentially, it's financially unfeasible, or the employees are too important to your business and continuity of the business to be able to put them on leave. And then you retain the documentation. And so we'll move on from there. In terms of what documentation to get from your employees, so those of you who are used to FMLA compliance, there's a very detailed and somewhat lengthy documentation process for normal FMLA leave. It's much more simplified for this. You still have to collect some documentation, but for the most part, it's a self-certification from your employee that they need the leave. And so they at least have to provide the name, the dates of leave, the reason for the leave, and certified that they're unable to work. So the leave forms that we've developed and been providing to clients, it requires the employee to certify under penalty of perjury that what they're putting in that leave request or that leave document or form is true. And then for the various triggers of leave, there's different types of information that I have to provide for each one. So if they're subject to a government issued quarantine or isolation order, they name the government entity. If it's on the advice of a healthcare provider, they name the healthcare provider. If it's caring for someone else, they identify that person. Now, interestingly, if they're taking the leave because you have to care for a child, they provide the name of the child, the name of the school or child care provider, and then they have to represent that there's no other suitable person caring for that child during the leave period. So that's intended to address the situation where perhaps you have, a two-parent household, and both of them are trying to take the leave at the same time, and only one of them really under this law is really entitled to take the leave. The other one's supposed to be at work. Now, you as the employer, I don't think under this law gets to decide as to which one stays and which one comes to work. But only one of them is entitled to the leave. And further, if the child is over 14, the employee has to represent there are special circumstances requiring them to provide the care. Essentially, I would say that they need to certify that the child is a special needs child and needs care. Because that was one of the issues that was interesting when the bill was first passed is, well, what if the child's 17? Do they really need, to be cared for all day long, and to the point that the person cannot come to work? And one wrinkle, and I'll point this out with the Alabama Safer at Home order under the point number 1 for taking leave for a government issued quarantine or isolation order. So if you go back to what I said at the beginning, we went from an order that was a stay-at-home order, at least on the face of it, said that citizens were required to stay at home unless they were going to work to essential business and things like that. But now we've gone to an encouraged to stay at home. The DOL, the US DOL, indicated that the first order from Alabama, the stay-at-home order, qualified as a quarantine or isolation order, meaning that it was a trigger for an employee to take leave under the emergency paid sick leave, which got them to the $511 a day paid leave. But now it's unclear whether this new order, the Safer at Home order, is going to qualify as a quarantine or isolation order, because it's not, it's not as strict. So until, the DOL, the US DOL may issue some further guidance on that. But based on my reading of the order, it doesn't look like a quarantine or isolation order to me anymore. Why does this matter? This sounds like, nerdy legal stuff. Well, it matters because you might have an employee who is either no longer entitled to the leave, or they may switch from entitlement number 1 for taking leave for a quarantine or isolation order to another provision, say going to number 5, they may still be entitled to the leave, but it's because their child's at home. And that's a big difference in pay. You go from $511 a day cap to a $200 a day cap. So it's important.
All right, so we have much more information to tell you, but we're really getting out of time. So I'm just going to fly through some of this information. Tax credits, I'm sure you've heard that. And a lot of my clients, when I first talked to them, they're like, yep, we know about the tax credits. We're going to make sure we get those. So
make sure you keep your documentation, because you may get audited in the future. And if you don't have that documentation that the IRS requires, this Form 7200, and the documentation from your employees that the need to leave, you may end up having to pay that back after an audit.
Yeah. All right. So Fair Labor Standards Act, if you have people teleworking, we just wanted to remind you that in this new world we're in, Fair Labor Standards Act still applies, and that you've got to make sure that your employees have a way to keep track of their time. So just wanted to mention that.
And if you're paying hazard pay, make sure that you're including that in their regular rate for overtime purposes for your non-exempt employees anyway. If you're paying an extra $1 or $2 an hour, or some shift bonus or weekly bonus of a flat rate, you got to make sure that it gets calculated into the regular rate for overtime purposes. You can't just hand them an extra $200 a week flat, and if they're working more than 40 hours, not include that in their regular rate and pay overtime on it.
All right, our next few slides were some EEOC guidance. We're going to provide these slides to you. They answer some great questions. There's also just information from the EEOC on the guidance under, having employees during a pandemic.
So a lot of this guidance has to do with the ADA, and generally speaking, in normal times, the ADA would prohibit employers from conducting medical examinations, certainly pre-hire medical examinations, and you typically want to steer away from asking employees whether they're showing symptoms of illness and things like that. That'll get you in trouble under the ADA. But as with a lot of other things, the normal rules have been suspended, and the EEOC has deferred to the CDC and taken the position that this pandemic is so crucial and dangerous that if you allow employees into the workplace with COVID, that constitutes a direct threat to others and perhaps themselves. And so they've relaxed some of the normal rules under the ADA and said that employers can take employee temperatures, screen them when they come to work, ask them questions about symptoms, send them home if they are showing symptoms, things that you normally would steer far away from under the ADA.
All right, I'm going to leave you, before we answer questions, I'm going to leave you with one final thing that I think is important, because as you're bringing people back to work, there's going to be a question of what if they say that they cannot come back to work? Will they still be able to get unemployment? You know, if you've had your employees on unemployment and now you need to bring them back to work. So normal disqualification from unemployment would be if someone quit work without having good cause, refusing to return to work, or refusing to return at full pay because they're saying, they really want to still get the unemployment. Well, now your employees may refuse to return to work for good cause, and that includes having a medically fragile person at home, meaning an elderly, family member that they have with them, someone who has cancer. They could say that I cannot come back to work because I cannot chance catching the coronavirus and then giving it to someone at home. Or children being at home because of a school closure. They can still receive unemployment for that.
So again, this is another example of normal rules being suspended. Normally, if you recall somebody back from a layoff or furlough, you got work for them, they refuse to take it, then they're going to be cut off from unemployment claims. But under the guidance from the USDOL that is flowing down through the Alabama Department of Labor, it looks like that they're going to accept good cause as being, or good cause for refusal to return to work or accept work, being that they still have to take care of their children at home at least through the end of the scheduled school year, which is about another month. So they may, if they stay home for that reason, they may get their unemployment benefits cut off starting around June. And the ADOL, interestingly, just last week, issued some guidance that got in the national news. It's basically telling everybody in Alabama, hey, reminder, you cannot engage in unemployment benefits fraud or else you might go to jail and have to pay it all back, which is a shot across the bow, I think. And just by the way, there's a way to report employees who refuse to return to work. So those of you who have responsibility for this, you're probably familiar with the new hire reporting process with Alabama Department of Labor. As you recall employees back to work, you need to make sure that you report that to the ADOL in that manner, and you can email them a spreadsheet, and you can also report it through that portal. And that's the way, and this is going to be very important because it's going to be how we protect our state's unemployment benefit fund, because they have paid $372 million in claims so far in the last few weeks. They've had over 400,000 claims in the last few weeks. And just to put that into perspective, that's far more than double the number of claims they had in all of 2019. In 2019, there were about 130,000 unemployment benefits claims in the state. We're over 400,000 just in the last 5 or 6 weeks. So that's caused a lot of administrative burden for the DOL. They've got about 64% of those claims paid so far, but they're running slower than normal, as you might expect. But in order to protect that money and make sure it's not wasted, we got to make sure as employers that, you're reporting back to them, the offers of employment that you've made, so that if necessary, people who don't accept work that's available to them get their unemployment cut off.
All right, Sonia, I know we ran a little long, but if anyone wants to stay on to answer questions, we'll do that.
It's 11 o'clock. We're good.
Yes, it is 11 on the nose. So this has been great information from Tim and Tom and Brooks. So thank you. I have a list of a few questions. One of the questions is, one of our participants plans to have employees take their temperature and then sign off on a list of symptoms. So they're going to put this into a form. If they do have a fever or COVID symptoms, what are the next best steps?
Well, I'll say this. So that's a common procedure that a lot of employers are doing, whether taking the employee's temperature, screening them when they get to work, or perhaps having employees take their temperatures before they leave their home and come to work. Because let's be honest, once they come to work, if they get into the office or into the place of business very far, and now they're showing they have a temperature, maybe it's too late. A common temperature threshold that I've seen used is 100.4 degrees. And so if you have somebody who tests at that, or has a temperature, reads temperature at that level, or they indicate some symptom, and keep in mind the symptoms are very common now. We've got, coughing, shortness of breath, fever. Now they've added, as Tim mentioned earlier, chills, shaking with chills, muscle pain, headache. Look, I'm 46 years old. I got 4 kids. There's hardly a day that goes by that I don't have muscle pain or headache. But if you have somebody that indicates that, if you're an employer that has these kinds of resources available, maybe having them, sending them to a secondary screening by a medical professional, company nurse or something like that would be the next best step. If you don't have that available, maybe the best thing is to send them home until they can get tested, which may take a little while. And certainly if you have somebody coming in showing a 102 fever, send them home until they can get tested. Like I said, it may take about a week or so.
We've also seen some of our clients, if they, if their temperature is, 101, allow them to go back to their car and be retested in 10 minutes, just in case there was anything going on. So, and then we just have to realize that not everybody has any symptoms. So this is not going to be, the end all of everything that we can do by taking temperatures and writing down symptoms, but it may be the best we can do right now.
And that's the sort of thing that under normal rules under the ADA, you would never do that, but it's allowed at least in this circumstance. And I will say something about the type of thermometers that are being used. So a lot of employers are using contactless thermometers, the little guns, and which is understandable because you don't want to use something that doesn't touch the employee. But I'm going to caution you, those things typically read a degree or two lower. They measure surface temperature only. And so if you've got somebody who's shows up and that contactless gun shows they're at a 99.5, they're probably really about a 100.5, maybe even 102.
Tim, I know one of your big points was, a lot around the training and the communications to employees. I mean, could you talk a little bit about, how that applies? We've had several questions related to temperature takes, not only for employees, but also for customers.
Well, I think Tom and Brooke did an excellent job with the employee question there. I think it is important that, that we educate our employees on the symptoms, and especially these new symptoms, add the new symptoms to it, right? So that's, so that they understand what the employer is going to be looking for, what they need to call in, if they need to call in sick. This is why I'm calling in sick. I've got chills. I've got a temperature. Maybe it's not quite 100, but I don't feel that great. Well, these are some things that we can tell our employees and that they can call in and give us a heads up, and then we can start that contact tracing. We can also give them the phone number for the COVID testing site, and we can tell them where it is. We can tell them the hours of it. So it's good to have those on hand. As far as customers go, I've talked with a few businesses that are testing customer temperatures. They're doing it with the customer's approval. I mean, of course, you have to ask that ahead of time before you do it. You just can't do it. And Tom and Brooke, how do you legally, do you have to have someone sign a waiver? I would think if you asked them and they gave your permission, you're good, but maybe y'all can speak to that.
You could refuse that.
Yep. Yeah, that's a great point. What are you going to do if the customer refuses? Are you going to service that customer, or do you choose to? I mean, are you going to make the choice to? It depends on the risk that you have. Are you going to? Your employees could be put in a risky situation of catching COVID. You need to evaluate that, and you need to do it actually before you put your employees back on the street or back in the in the retail space, so that you have a plan, it's documented, so that you can be consistent for the next several months to a year, 2 years, moving forward through this. And those, like Tom and Brooke said, things are going to be changed, and they're changing sometimes day to day, week to week. As things loosen up, maybe that won't have to be such a big issue. But right now, I think it's important to protect your employees and express to your clients that the steps you're taking are for their protection also.
Is it a HIPAA violation to take a temperature take or on a customer or a member, or have them sign the waiver?
I do not think so. You're not certainly for a customer, and you're not storing the data anywhere. And with an employee, and Tim, you can speak to this as well. You probably know as much or more than we do on this, but for an employee, I mean, you're collecting that data as their employer, not as a sponsor of their health plan provider. So no, it's not a HIPAA violation merely just to take the temperature.
You do.
Yeah,
There are requirements for the information that you are maintaining, that
That's
you
true.
keep it private and you put it in their medical file rather than their personnel files, or just in a stack somewhere where everybody can have access to them.
Excellent point. Yeah, you cannot let, I mean, if you take a measurement on an employee before they enter the office space, you really shouldn't even call out the temperature. You should ask them to step aside and have someone ready to talk with them, and maybe give them that phone number of the texting facility, the contact information for that. But yeah, you can't talk about that temperature. And for the excellent points, you've got to put it in the right file.
And I'll add to this, but for those of you who stuck with us this long, you're going to get a little lanyard here. So if you got employees who are lining up to take their, to pass these screenings, and they're not on the clock yet, we're talking about non-exempt employees, they're not on the clock yet. There's an FLSA issue there in terms of them being paid for that time. There are going to be, and if not there, if they haven't already, there's going to be a lot of lawsuits under the FLSA claiming collective action claims for unpaid hours worked for employees who happen to be stacking up to go through this screening process before they're actually on the clock.
Right. Tanya?
So, outside of temperature takes, can employees be required just to sign an agreement to follow general CDC regulations that the businesses says these are the ones that we're going to follow?
Yeah, I mean, I think that employers are putting out memos. We've already done one here where we're saying here's our return back to work plan. And yeah, I mean, I think it's like any other employment policy, as long as you don't have any policies that are, against the law in there, as long as you're doing the things that we're being allowed to do under, the ADA guidance and things like that, then you can say these are new employment policies and you need to comply with them.
Yeah, you have to make sure that you enforce those in an even-handed manner, not be discriminatory. I mean, the EEOC has also already issued essentially warnings or guidance to make sure you don't discriminate. Employers don't discriminate against, say, employees of Asian or Chinese descent. You're not suddenly testing your Asian or Chinese employees because you're more concerned that they've got this virus than others. So you got to make sure you implement these plans in an even-handed manner.
What do employers do if, say, they have taken that step and they have an employee who has signed the agreement, and then there is information that comes to the employer, whether through social media or another venue, that they're not following those, they're not following what they sign in terms of their personal, relationships and friendships. Maybe they put a post on social media where they're in very close contact. What does the employer do around that employee being able to come back to their work?
Well, that's a pretty sticky situation. What I would say is that as long as they're showing up to work and they're passing the screenings, meaning they're not showing up with temperatures and passing the screening if you have screening in place, and they're observing the employer's rules within the office, then that's about all you can expect from them. You really want to get into position of firing somebody because they were too close to somebody away from your place of business. I'm not a fan of that prospect, to be honest.
So we do have some questions related to the emergency paid sick leave requirements. So if someone has symptoms, but they weren't tested for COVID, do they use the employee benefits that provides the 80 hours of sick time since they automatically get it? So do they keep their 80 hours or not?
You mean that they were tested, so for example, under the emergency paid sick leave, they can get some paid leave if they have symptoms and they are looking for a diagnosis. So your question is, if they get that diagnosis and it was negative?
Well, I think this is the case. So this person hasn't been tested for COVID, but they are displaying symptoms. And if they have already got 80 hours of sick time, but they don't use the emergency sick leave, do they still if they use the emergency sick leave, do they still keep their sick leave that's been provided by the employer?
Yes, I mean, whether they use or don't use the emergency paid sick leave required under the FFCRA, they still have whatever the sick leave that the company provided previously under policy. So if they went into this pandemic with 2 weeks of company paid sick leave, whether they use emergency paid sick leave required by the bill or not, they still have their company paid sick leave bank.
But if they're having symptoms, I guess the question is if they're having symptoms, but they haven't been tested for coronavirus, I think that what's going to happen in these situations is that the employer is going to have to be working with these employees all the time, trying to, why are you needing to be out? We need to discuss this. What are you doing? Are you getting tested? And figuring out, are we supposed to be using emergency paid sick leave, or are you sick for some other reason and you need to be using your company provided paid sick leave?
Right. Okay, we have a lot more questions, but I know that we have gone significantly over. So what we're going to do at this point is we have a copy of all of the questions in the chat. And so if we'll have Brooke, Tim, and Tom kind of reach out and try to answer your question. Also, each one of them provided their contact information. So you're certainly welcome to send in your question independently, but we really appreciate everybody joining us. I think we could probably be in a Q&A session for 2 hours.
Okay.
We recognize this is really complicated, but I just want to encourage everyone, it's good that we're having conversations around returning to work. This is good for business. Definitely take a look at the return to work guide that Valiant Group and Tim Rogers put together. He talked a lot about there's options for employers. So you can do A or B. If you do A, you must do these other steps. So make sure that you're checking that out. Both Constanji and Tim at Valiant have put out COVID resource pages around return to work. So check out those websites for some more information, and best luck to everyone as you get back to business. We appreciate you.
Thank you for joining us.
Thank you, everyone.
Bye-bye.